My name is Judith Nassaazi. I'm a pediatric orthopedic surgeon. I work at Korsu Hospital. Korsu is a hospital that in Uganda, located in Entebbe, and it does the most pediatric orthopedic intervention in the country. I'm currently a CHESA fellow. I joined CHESA in 2023, so I'm actually concluding my fellowship this year. Yeah. So I can't remember how I fell in love with medicine, but I remember my parents telling me that I was actually about 9 years old, and I told them I think I'll be a doctor. They don't know where it came from, but I sort of didn't look back, and because I had decided I want to walk along those lines, I just kept growing that love and passion for medicine. And then I got into medical school, and then there was no turning back. It's weird how initially I had decided early on in my career that I was not going to do anything pediatric related, but then I got into orthopedics, and I had decided to go the route of actually doing spine surgery, but just along the way I fell in love with treating children, probably because the people who were teaching me about treating children were so passionate about it, and then I got to love it as well. So yeah, then I decided it was pediatric orthopedics for me, and I haven't looked back. I'll say for Uganda in particular, I work in a center that sees very many children, but most of the children you see actually have neglected deformity. So it's an underrepresented community. It's the pathology itself is underappreciated, and there's also lots of misinformation or even lack of information about the right treatment for this kind of pathology. So it's a good thing that we're seeing lots of it, because in the past they didn't show at all. They thought there was no care for this kind of pathology they had, but they're actually coming around more. Part of the reasons for the increased numbers is the population is growing, so more kids are born, therefore these deformities are seen more. There are most of them are related to neglected trauma. So kids get injuries and they're either not managed adequately or not managed at all, and then they present later with these deformities. We also have problems that you typically see in low and middle or low middle income countries as a result of nutritional deficiencies and an infection, sequelae of infection. So those are the main reasons as to why we're having, or at least we're seeing lots of this pathology coming around. Yeah. At the moment, we are 6 pediatric orthopedic surgeons in the country, and so think about how many children are in the country. It's very massive. So we still have a very long way to go. But that aside, just thinking of orthopedics in general, like orthopedic surgery, we are maybe about 80 in the country, and with a population of over maybe 43, 44 million, you can see that the ratio of doctor to patient care is still massive. So we still have a lot of work to do in building the numbers of the health personnel to take care of these patients, and in actually giving them the care that they need. So my mentor is Dr. Colleen Sabatini, and she's been coming to Uganda for many years now. But I sort of met her at a time where I was like transitioning I was at a point in my life or in my career where I was, sort of going through a transition, and I needed that person, the IT person, to help guide me along the way. And then I met her, and being keen on research, it was very helpful to have met her at that time. So I was writing up a few research projects that I wanted to work on with her, and I was thinking about applying for funding and respective grants for these projects. and she happened to talk to me about CHESA, and it wasn't just so. It started off as just wanting a grant for a research project, but then she told me all these other things that are part of CHESA, like the mentoring bit, the continued education, through the different means, like the in-person and the virtual Zoom meetings that we would have, the different to network with people in sort of the same career. So that's how I got to know about CHESA, and she's sort of been guiding me along the way and mentoring me, like I've mentioned earlier. Yeah, so the title of my project is assessing the difference in show-up rates for children who have undergone guided growth surgery through appointments that are done either in person or virtually. So I think you've seen some kids, having either bowed knees or knock knees. There are times in their lives where it's normal to have that, but beyond that certain time, it's pathological. So that needs to be treated. There is a way we can treat it without having to break the bone. So that way is called guided growth surgery. So when you do guided growth surgery, we put some small implants next to the growth plate to help tether the growth plate and help the bone become straight. The issue is that if those implants stay beyond their time, then they overcorrect. So a knee that starts out as bowed could end up knocking, or one that starts off as knocked could end up overly bowing. So you don't want them to go beyond the time or beyond the leg being straight. That was the issue that was happening before, that they would overcorrect and then they need another surgery to take them back to what they've missed or what they had before. So we want to assess and see that if we follow them up virtually, does it make a difference? Do they show up more? Do they miss their appointments less? Or actually, it's the same thing when we're seeing them in person. So that's entirely what my project is about, to see if introducing this telehealth aspect makes a difference. Yes, I do have some advice. It's important to prioritize the things that you're going to do. But if you join CHESA, try to show up for as much as you can, because you actually need to be present to enjoy it and to learn all these things that the faculty wants to pass on to you. It's a mentorship that I wish it's a project and a fellowship I wish everyone could sort of be a part of. And I know that might not be possible. And I know the applications they've been getting, they're coming around in bigger numbers than they did before. But it's something I wish very many of the doctors would get access to, because we don't get the mentorship, or at least I did not get the mentorship during my residency program that I have gotten through CHESA.